Hello everyone, I am Dr. Shankar Dey. Welcome to 8th video of NEET-PG recall question session. So starting with question number 71, a patient came with history of penetrating trauma to the eye. Sympathetic ophthalmitis was diagnosed. Which of the following will be seen in this case? So as all of you know, sympathetic ophthalmia is associated with which type of uveitis? It is pan-uveitis. So sympathetic ophthalmia is associated with pan-uveitis. After penetrating trauma, whenever the sympathetic ophthalmitis develop, it involve all the layers of uvea. So it is pan-uveitis. Next question, image based question, straightforward question. What is the image showing? This is showing nothing but pseudo exfoliation syndrome, one of the most common cause of secondary open angle glaucoma. When it blocks trabecular meshwork, it causes pseudo exfoliation glaucoma. So this is pseudo exfoliation. See the pseudo exfoliation. So this is image of pseudo exfoliation syndrome. 73, absolute contraindication for cervical cerclage operation in a patient with cervix 1.8 cm. Among the 4 options given, the options will be ruptured membrane. So the ruptured membrane is the absolute contraindication for cervical cerclage operation. Next, coming to question number 74, this surgery is done for. Just look at the image. This was the image, and here you can see the presence of some ring like structure inside the cornea. So this is implantable intracorneal ring. Brand name is like Intacs. This operation INTACS, Intacs, implantable intracorneal ring. This surgery is used for keratoconus surgery, the Intacs or implantable intracorneal ring for keratoconus. Question number 75, copper T is contraindicated in menstruation? No. False. After delivery? No. In postpartum or puerperal period you can insert copper T. After condom rupture during intercourse? No. This is also false, because in these 3 cases you can use copper T, because for option C, even after rupture of condom during sexual intercourse, you can use copper T as an emergency contraception within 5 days. So first 3 option is correct. So copper T is contraindicated in post-molar evacuation of trophoblastic tissue. So it is not used following evacuation of trophoblastic tissue. Okay. Coming to question number 76, diabetic patient with preretinal hemorrhage and neovascularization of discs. So this is definitely proliferative diabetic retinopathy. As you know, there is 2 type of diabetic retinopathy, proliferative and non-proliferative. And for proliferative diabetic retinopathy with neovascularization of disc and panretinal hemorrhage, ideal treatment is panretinal photocoagulation. Panretinal photocoagulation. This is the ideal treatment for proliferative diabetic retinopathy. So PRP, pan-retinal photocoagulation. And the treatment anti-VEGF, vascular endothelial growth factor, can also be used. And lastly, whenever this fails, we can what can be done, that is vitrectomy, pars plana vitrectomy. So this is about question number 76. Coming to question number 77, the structure being given traction whenever is torn and lead to excessive vaginal bleeding. So the structures being given traction, what is the structure that is being given traction? This is the structure. This is nothing but cord, and this procedure is control cord traction. So during this procedure, cord is being given traction, and during traction this is being torn and lead to excessive bleeding. So this is being torn. So what is the next best step? Next best step is manual removal of placenta. So this is the best step, not the oxytocin and uterine massage. Manual removal of the placenta is the best step following torn of cord during control cord traction. Coming to question number 78, preeclampsia patient post cesarean section, drowsy, respiratory rate decrease, urine output is also low, decrease, bilateral knee jerk absent. So this is it. As this is a case of preeclampsia, this may be because of some drug effect that is used in preeclampsia, that is MgSO4, magnesium sulfate. As all of you know, one of the most popular regimen for preeclampsia, Preeclampsia regimen, that in this regimen magnesium sulfate is used, and magnesium sulfate toxicity can cause this type of features: absence of jerks with decreased urine output and respiratory suppression. So the answer diagnosis in this case is MgSO4 or magnesium sulfate toxicity. Coming to question number 79, patient with fatigue. Patient with fatigue, hemoglobin 9 means hemoglobin is reduced, MCB also reduced. It is showing microcytic hyperchromic anemia, and RBC count is normal 5.2. So what is this case? Is this case a iron deficiency anemia? There is a microcytic hypercytic anemia. Is this a iron deficiency anemia? This is definitely no. Though the hemoglobin MCB says why? Just calculate the Menzer index from this question. Menzer index. So what is the equation for Menzer index? It is MCV by RBC count. So here MCV is 60, RBC count is 5.2, almost 6. If I, so it is coming near around 12. So 12 or less than 12. So if Menzer index is less than 30, it signifies thalassemia. And if Menzer index is more than 30, it signifies iron deficiency anemia. As in this case Menzer index is 12 or less than 12, means more less than 30, this is definitely case of thalassemia. So for thalassemia, next best investigation will be hemoglobin A2 level, because in case of thalassemia, normal hemoglobin A, as beta globin chain is not synthesis properly, hemoglobin A will be reduced, but hemoglobin A2F, this will increase. So hemoglobin A2 will increase in case of thalassemia. Both thalassemia major, minor. So next best investigation will be hemoglobin A2, not serum ferritin level. Coming to question number 80, patient with swelling in front of neck and fatigue. Examination shows hypothyroidism and anemia. Which is common? In case of hypothyroidism, macrocytic anemia is common. Megaloblastic, you should not mark megaloblastic because of this is deficiency of vitamin B12 and folic acid, not necessarily iron deficiency anemia. Hypothyroidism, neck swelling and fatigue is suggesting hypothyroidism, and with anemia, in case of hypothyroidism, macrocytic anemia is common. In the next video I am going to discuss next set of questions, so stay tuned for the next video and don't forget to subscribe my channel. Thank you very much for watching.